What exactly is this disease? How can one get colorectal cancer?
Colorectal cancer is any cancer that happens at any part of the colon or the rectum, which is about a 3 foot, tubular organ that connects the small intestine to the anus. And colorectal cancer can happen to anyone. There are some risk factors such as family history, certain diseases like inflammatory bowel disease that can increase someone's risk. And unfortunately, age can also increase the risk of colon cancer as well, which is why we recommend routine screening, even if people don't have any specific risk factors.
And also, what are those signs and symptoms to look out for?
Unfortunately, colon cancer doesn't always have any type of signs and symptoms until it becomes more advanced. Some symptoms of advanced colon cancer include anemia or GI bleeding, weight loss. If it becomes too large, people could notice constipation or just nausea and vomiting from the obstruction from the cancer.
And then next question is treatments. What are the treatments needed for this specifically?
Yeah. So for colorectal cancer, a very small minority of patients may be lucky enough that when gets diagnosed during colonoscopy, the endoscopist is able to excise the tumor completely. Unfortunately, a lot of times when we do the colonoscopy, it may be too late because we're doing it for symptoms of advanced colon cancer, such as bleeding or anemia or weight loss. And at that point, we'll have to discuss the treatment options depending on the stage of the cancer. And the option could be anything from a simple surgery, or not a simple surgery, but just a surgery when and done. Or if this disease is more locally advanced or metastatic, then patients often need chemotherapy and possibly even radiation.
And me and Allison were talking about how this disease, this cancer, has started to become more common among people under the age of 50. Why
Mhm.
is that?
Yes, so since the 1980s, we in the US have started an initiative to screen all adults 50 years of age or older with colon cancer. And so fortunately, since then, the incidence and the rates of death for colon cancer has been on the downcline in people over 50. However, we've seen that in the age group of people from age 45 to 54, the incidence and the death rate hasn't really significantly gone down. And people who are between the ages of 40 to 54 have we're seeing a larger share of the incidence and deaths of colon cancer, which is why now we are recommending screening from age 45.
Yeah, that was going to lead into the next question, but we covered that one. I was going to ask about how one can be proactive. And it was going to be, yeah, when should people start considering to get screened? And so if you'd say 45 years of age, nothing younger, like should I be concerned as a 20-year-old in the 20s? No?
Right. So we do have few cases of people as young as early 20s even who have colon cancer, and that's the reason why when we hear about anyone with symptoms such as rectal bleeding or anemia, we don't take it lightly. We often want to just do a colonoscopy just in case. It's a very minimally invasive procedure. It's very safe. Um, it takes about 20 or 30 minutes. And, just with that look, we can be sure to, let you know that whatever bleeding is not from cancer. Or if it is, then we can go ahead and treat it as early as possible.
Exactly. Yes, ma'am. And yeah, any other additional ways someone can be proactive with all this?
Yeah, so definitely talk to your primary care physician and let them know about your symptoms, let them know about your family history. Certain patterns of family history may signify that you could qualify to get screened earlier, or that you maybe need to be screened earlier and more frequent than the general population. Um, Otherwise, if you have any concerns about bleeding, or if you're concerned about any weight loss or even abdominal pain, changes in bowel pattern, those are all things that you should discuss with your primary care physician, and they can further evaluate and see if you need a colonoscopy.
Well, perfect. That is everything that I wanted to cover. But is there anything else that you wanted to add that I didn't ask you for my story since colorectal cancer awareness month is March?
Yeah. So we do focus on colorectal cancer because it is the second most common cause of cancer death in the US. But I would like to add that colonoscopy isn't just for screening for colon cancer, it's actually to prevent colon cancer, which is why since the 1980s, when we started colonoscopy, screening colonoscopies on the general population, we've seen a downtrend in incidence and death and colon cancer. And that's because when we do colonoscopies, we're able to find small polyps, which are precancerous lesions, and we can take them out, and that can prevent the polyps from growing into colon cancer. And that'll save, many people from having to be subjected to surgery, chemotherapy, and radiation.